Hello everyone, welcome to another video. In today's video we'll be looking at a completely different topic, and we'll be focusing on migraines. Basically migraines, they are a common neurological disorder, and they are characterized by recurrent episodes of moderate to severe headache. So migraines are not like normal headache, they're like a different kind of headache. At the end of the video, we'll look at the difference between migraines and normal headaches. But let's focus on what is migraine, what are the signs and symptoms of migraines, like how do we know when we're having a migraine. So like I said, a migraine is a common neurological disorder and is characterized by recurrent episodes of moderate to severe headache, and is often accompanied by nausea, vomiting, and sensitivity to light and sound. So usually migraine attacks, they can last from a few hours to several days, and they can significantly impact the quality of life. So migraines, they are classified into migraine with aura and migraine without aura. So looking at the background of migraines, so migraines, they affect approximately 1 in 7 people globally, and it is usually more common in females than males. So onset typically occurs during adolescence or early childhood, and the condition is believed to involve abnormal brain activity affecting nerve signals, chemicals, and blood vessels. So that is one of the difference between migraines and normal headache. So normal headache can be due to stress and all those things, but migraine is a neurological disorder. So looking at the causes, number one, genetic disposition. So if you have a family history of migraines, there's a possibility you can also start having symptoms of migraines. Then hormonal changes too, especially in females during menstruation or pregnancy. So like for example, when I'm on my period, I usually have this kind of headaches. Like, I don't know how to explain them, but they are just always there. Like, even if it's like weeks, even if it's like, let's say, a week before it starts, like there's always this headache. So hormonal changes during menstruation and pregnancy too can cause migraines. That's why it's more common in females. Then stress and anxiety, sleep disturbances, like when you're not sleeping well, certain foods and beverages like chocolates, alcohol, because alcohol withdrawal can actually cause migraines, or like having when you are hungover. And then aged cheese, like cheese that is not good again, that is showing signs of like decay. Then caffeine too can cause migraines when you are taking excess caffeine because you want to stay alert, excess of these energy drinks. So all these things can cause migraine. Then environmental triggers like loud noises, bright lights, and strong smells, so they are also a cause. And also skipping meals or fasting, like I don't know, I think it's a general thing. When you don't eat for like a long period of time, your body demands that your body needs this food, you just start having this kind of pounding headache that you don't even know how to explain. So it's an example, like when you skip meals or you're not eating well or you're fasting. So migraines can occur in this case. Then looking at the types of migraines, so we have migraine without aura. This is the common migraine. So it's the most frequent type, and it comes with moderate to severe headache, and is usually unilateral. So unilateral means like one side of the head. Then it's usually accompanied by nausea, photophobia, or phonophobia. Then we have migraine with aura, which is the classic migraine. So with this migraine with aura, it's preceded by reversible neurological symptoms such as visual disturbances, numbness, or speech difficulties. So that's why it's called migraine with aura. So this reversible neurological symptoms is what is known as aura. So there will be visual disturbances, speech difficulties, and the aura usually lasts less than 1 hour. Then we have chronic migraine. So chronic migraine is a kind of headache that occurs on 15 or more days per month for more than 3 months, with features of migraine on at least 8 days. Then we have menstrual migraine, like I explained earlier. So it occurs in relation to the menstrual cycle due to like hormonal fluctuations. Then we have hemiplegic migraine, which is rare, and it occurs it includes temporary paralysis or weakness on one side of the body. Then vestibular migraine, which is prominent dizziness or balance disturbances with or without headache. Then we have retinal migraine. So here there will be visual loss or disturbance in one eye, and it's usually temporary. Then there's another severe migraine that is known as status migrainosus. So status migrainosus is a severe migraine migraine attack that lasts more than 72 hours, and it is usually resistant to treatment. So this is the most severe form of migraine, status migrainosus. Then now looking at the signs and symptoms of migraines. So when someone has migraines, there will be something known as prodrome. So prodrome is like the hours to days before headache. So there will be mood changes, food cravings, neck stiffness, increased yawning. Then some patients will have this aura, that is reversible neurological disturbances like visual disturbances, flashing lights, seeing zigzag lines, speech difficulties, numbness or tingling. Then the headache phase. So how the headache usually comes in migraine is it's unilateral. So it could be one side of the head, and then it could be bilateral, that is both sides, and the pain is usually throbbing, like is very prominent. Then there will be sensitivity to light, photophobia, sensitivity to sound, there will be nausea, and then vomiting. Then we have the postdrome phase. This is the phase after the headache. So there will be fatigue, the confusion, and there will be residual head pain. So migraines usually involve the trigeminal-vascular system, and stimulation of the trigeminal nerve causes the release of neuropeptides like calcitonin gene-related peptide, leading to vasodilation and inflammation of the cranial blood vessels. So cortical spreading depression, a wave of neuronal and glial depolarization may underline the reason why we see these oral symptoms. So looking at the pathophysiology of migraine, so a trigger usually leads to the activation of the trigeminal nerve. Then this will now lead to the release of vasoactive neuropeptides, and there will be vasodilation and neurogenic inflammation, which will occur in the meningeal vessels. Then there will be transmission of pain signals to the brain stem and the cortex, and then there will be central sensitization, which will contribute to the prolonged headache. So looking at the differential diagnosis, like other conditions that could mirror the same symptoms as we see in migraines. For example, we have tension type headaches. So tension type headaches, they are usually bilateral, having the pressure on both sides of the head, and they are pressing, they are like the pain is pressing and tightening, but there's usually no nausea or vomiting involved in this case. Then we have cluster headaches, which is in one side and is very severe and is often around the eye and associated with nasal congestion and tearing. Then we have sinus headache, which comes with facial pain, facial pressure, and is usually worse when bending over. Then another condition that could mirror the same symptoms that we see in migraine. So there's something called intracranial mass or intracranial hemorrhage, and it comes with a sudden severe headache and some neurological deficits. So how is migraine diagnosed? So first, we look at the patient's clinical history and we do a physical exam, and this is usually the key for diagnosis of migraines. Then there's something called neuroimaging. So we do neuroimaging using MRI or CT, and it's only done if red flags are present, like sudden onset of this migraine, or when the patient has neurological deficits or like atypical symptoms. So then we also use a criteria for diagnosis known as International Classification of Headache Disorders. So we also use this to help us in diagnosing if a patient has migraine. So for the treatment of migraine, so for the acute management, we can give analgesics like paracetamol, 1000 milligrams orally at the onset, and we can also give ibuprofen 400 to 800 milligrams orally, or diclofenac 75 milligrams. And then we can also give for moderate to severe attacks, we give triptans like sumatriptan 50 to 100 milligrams, or we give rizatriptan or zomitriptan as alternatives, which have faster onset. Then to combat the nausea and the vomiting, we give antiemetics like metoclopramide or domperidone. Then corticosteroids too are given in cases of severe migraine that I mentioned before, known as status migrainosus. So we give dexamethasone intravenously 10 milligrams. So for the prophylactic treatment of migraines, so we consider if the patient has 4 or more migraine days per month or significant disability. So we can give beta blockers like propranolol per day, or we could give tricyclic depressants like amitriptyline and anticonvulsants like valproic acid, or we could give calcium channel blockers like flunarizine. So these are usually given for the prophylactic treatment. So for special populations like children and pregnant women, so in children we try to avoid giving them triptans, especially in younger children. And then for in pregnancy, we prefer to give paracetamol and we avoid triptans, and we also avoid NSAIDs, especially in the 3rd trimester of the pregnancy. So for the general prevention of migraines, it's better to keep a migraine diary to identify and avoid triggers. If you know what is triggering the migraine, like every time you do this thing you always have migraine, maybe every time you don't eat for a certain number of hours you start to have this migraine, or every time you take something. So just keeping a diary to identify what is triggering the migraine to start. Then try to practice regular sleeping and regular hydration and regular meals. Like try to take I know it's not easy to take the usual 3 square meals, because even me, I'm lacking in that section. So but try to at least, whenever your brain is signaling you that okay, see you, we are hungry, like try to get something to eat. Then stress management, so some stress management techniques like yoga can be helpful. Then limiting caffeinated drinks, like always, you want to always stay alert, like try to limit the amount of caffeine, because caffeine, on the long run, caffeine is not really advisable. Like it's not it's not good for the brain, it's not good for the heart. So try to limit the amount of caffeine that we take daily, and alcohol too. Then also doing regular exercises can also help. So migraine is chronic but is a manageable condition, and many patients experience a decrease in frequency with age. So effective treatment and lifestyle modifications significantly improve the quality of life of the patient. And there is also risk of progression to chronic migraine if the common migraine is not treated properly. So now let's look at like what is the basic differences between normal headache, that is like tension type headaches, and migraine. So tension type headaches, they are, like, from the definition, is like the general discomfort or pain in the head, and is caused by muscle tension or stress. But migraine is a complex neurological condition characterized by moderate to severe throbbing pain, and often has additional symptoms like nausea, vomiting, light, sensitivity to light, all those other things. Then looking at the cause, common headaches are caused by stress, muscle tension, dehydration, fatigue, blah blah blah, poor posture. Then migraines, they are believed to be caused by like abnormal brain activity. So for the onset too, like normal headaches, they are gradual and they often build up over time. So with migraines, they may be preceded with, like, before the headache, you could see like the oral symptoms like visual disturbances, speech difficulties. So they may be preceded with warning signs and can come suddenly. Then looking at the location of the pain too, so for common headaches, it's usually on both sides of the head. It can be across the forehead, it can be at the back of the head. But with migraines, it's typically on one side of the head, so it's unilateral, and or it can affect the whole head itself. So that is based on the location. Then the type of pain, so with migraines, there's throbbing pain, like pounding pain, like pain that you cannot just ignore. Then with headaches, it's dull, it can be pressing, it can have it can feel like there's like a tight band is being wrapped around the head. Then for headache, you usually don't see associated symptoms like headache, or like nausea or vomiting. You don't see all those kind of associated symptoms. But in migraine, you have nausea, vomiting, you have photophobia, you have phonophobia, you have visual disturbances. So all those things, you don't see them in the common headache. Then headaches don't usually come with common headaches don't usually come with like aura, those warning signs. And then the duration too also matters, because when it comes to headaches, it can usually occur for like 30 minutes to a few hours. But with migraines typically last longer, like 4 to 72 hours if left untreated. Like migraines can last for days if they are not treated. Then based on the frequency, normal headaches can be occasional or frequent, especially during like stressful periods. And migraines, they can occur like few times a month, or they can be chronic. And another particular differentiation is normal headaches, they are not worsened by routine physical activity, but migraines are usually worsened by movement or physical activities like climbing the stairs or walking. Then for headaches, there's usually relief by when you rest, or when you are properly hydrated, or when you use normal over-the-counter painkillers. But with migraines, you may need prescription medications like triptans, and relief usually requires early intervention. So and also looking at the impact on the daily life. So the impact of common headaches can be mild, and it does not usually typically disrupt daily activities. But when it comes to migraine, it's like disabling. Like it will require, sometimes it will require you resting in the dark based on like those oral symptoms and everything. And then for headaches are never chronic, like they are rarely chronic, but you have cases of chronic migraines if the episodes occur like frequently. So in summary, when it comes to normal headache or tension headaches, it's usually bilateral on both sides of the head. There's dull pressure, no nausea, no aura, and it's usually not worsened by activity. But migraines, one side of the head, pulsating, severe pain, there's nausea and vomiting, there's photophobia, phonophobia, and is worsened by movement. So with these few points of mine, I hope I'll be able to convince you and not confuse you. Thank you for watching this video, and yeah, we'll see you in the next video. Bye.